Now we're going to start thinking like a criminal. This is always fun. First one, George works for City Community General Hospital. He reports to the VP of Operations. He's trained as an electrician. He attended trade school. Worked at the hospital for 5 years. General maintenance for the hospital. He has many friends that he's considered a great employee. But he had a problem. He was involved in a serious auto accident, and he has an unscrupulous attorney that is representing him. He's now dependent upon painkillers. His marriage is shaky, and he has money problems. If you have somebody like this, and we all do, we all have this issue. This is a person who, if their attorney said, "How would you like to make some money?" they would probably say, "Okay, you don't want to do that. This is why you have safeguards in place. The people who are doing your maintenance should not have access to your data, period. Which means that when people leave their desks, it doesn't matter who's standing behind them. If it's him, it's a problem. But if whoever's standing behind them, they need to know that they need to lock down their computer before they leave their desk. Otherwise, a savvy person can easily download the information that they want. Flash drives work very easily. Next case. Mary works for City Community Hospital, and you're her boss. You hired her 2 years ago. She previously worked at a doctor's office. All of her reference checked out. She has a high school diploma, and she lives as a single parent. She earns a little bit more than poverty level, and she has 2 children. She lives in low-income housing and does receive food stamps. Mary's sister knows someone with an apartment for rent in a better neighborhood and has been pressuring Mary to move. Again, would she, if she had the opportunity, steal your information? Would she, if she could, allow somebody access into the computer? Okay, she's a registrar. She has the access codes, and they have access. Let's face it, in the emergency department, you can gain the data on every patient in the building. I probably never think twice about it. So your computer people have logs about who's accessing what information. Another one of those things that you should do, and nobody does, is every once in a while, make it as part of your quality assurance for HIPAA. Go through the logs as to see what patients these employees are looking at. If she's looking, if Mary, for instance, if you go into her file and you see that she was looking at a patient who was admitted for an auto accident 3 months ago, but she's looking at it tonight, then you got to wonder why. Why would they be doing that? You can't go down there and accuse her of doing something wrong. You need more than that. But at least it gives you a direction to go in. If you don't do it, this is almost a willful violation then. And truth be told, if you don't want, if you're willing to pay the fines, don't look. But this is the type of thing that happens. George and Mary both need money, and if any attorney will give them $50 for every accident chart that they can get their hands on, guess what? They were going to do it. And then one night, they meet in the emergency department. It was a quiet night. Mary left that they all had the night. All they had all night was auto accidents after the bingo game at the community center. 10 people in all. George did the math, and Mary agreed. All right, here's something for you guys to do, if you would. And you don't have to do it, but if you want to do it, do it. Take a photo of your business card and text it to my mobile number, 609-515-0669. Fastest wins. I'll be looking for it. What's the purpose of that exercise? Let that sink in for a second. If I took a photocopy of if a patient's paying their deductible with their credit card, and your staff has a cell phone with them, how fast can they take a photocopy of that credit card? Now, is it minor? Yeah, so yeah, they're not going to steal that much. They can't get away with that much before the credit card company or the bank will shut it down. But guess what? It only takes one. And you have to realize from your hospitals or your facilities, what does it look like in the paper? You know the local paper will gladly carry something bad that happened at your facility whereby patient health information was taken, even if it did not rise to the level that you had to report it to the newspaper. Always presume it will be. The hospital I was talking about up in New York, it was 11 employees were eventually arrested and prosecuted, and they had stolen 3 times their annual salaries. Oh, here's a question. Wherever you work, whatever you do, if you're going to steal information, how would you do it? How would it be detected? And if you find somebody doing it, what will you do if you discover it? Let's think about that. You walk into your office every morning, and I don't know if you're the first in, second in, but if you were looking at your EMR, how would you steal all that information? It's very easy. All of your medical records, probably you can export them to a PDF. Something in Adobe, so you can download it onto your flash drive, and flash drives nowadays hold a plethora of information. You could put a lot of medical records onto one simple flash drive. Or if I was tech savvy, if I was smart enough to do it, we used to teach this program in person, and I had a tech person that I worked with who would spend a whole day with the hospital, and at lunchtime drop 15 flash drives in the parking lot. And we would tell people, and I'm telling you now, if you find a strange flash drive, don't plug it in. And you laugh about it. You don't know where that flash drive's been. But there's a reason that flash drive was left laying around or in the street or in the parking lot. There's a reason for it. Don't plug it in. It can easily upload what may be called a virus or malware to your computer that then feeds all of your patient data outside your building. And that is bad. That is really bad. It can get around your firewall that way. What he would do is lay out 15 at lunchtime. And never, ever did it cease to amaze him that after lunch, at least 12 would have been plugged in, because it went to his computer, who plugged the flash drive in, even after they were told never, ever to do it. Why? Well, most people said I was being a good Samaritan. I thought somebody lost it. If I looked in the flash drive, I could figure out who owned it, and I could give it back to them. Big, huge mistake. Okay. Now, other information that you would want to leave the building with. Obviously, paper. Paper information, if you have it, is easy to get out the door because nobody questions administrators walking out the door with a big briefcase full of paper. I do it, just to take it home and give it a ride home and ride it back to the office the next morning. But the fact is that you have that information out there. When you're doing audits, you have a ton of paper laying around. Do you know where that paper is, and is it secure? Harkens back to the days when we did a lot of drug testing, and all of the results would come through on a fax machine. You had a requirement to have a secure fax. Oh, what's a secure fax? Well, a secure fax is somewhere where only one person can see what's in it, and and the door locks at night. Not terribly secure, but I guess it was good enough. Now, if you had people who were getting into the computer or were faxing stuff out, how would you detect it? One thing was observation. If you see people making photos, taking photos with their phones of patient records, probably an indicator that you need to check out. If you see somebody standing at the fax machine a lot more than they should be, a lot more than anybody else is, probably something you should check out. Patients' questions, like, where are such and such files? Well, they may need to know it, but they may be also looking for something. Maybe check it out. Now, are you going to accuse them? You better not, because you need to maintain the morale of your employees. We have so many people looking for work nowadays, but a lot of them just aren't good with patients. So you need to make sure that if you got a good employee, just make sure that you know what you're moving towards. More thoughts. Dropbox. I don't know if everybody knows it, but it's also akin to Google Docs. I use it extensively. I use this, and I sit there and I think, what would be the reason, or how can I make this more secure? If I send myself, no, basically what I send is financial information, so it's not patient information. But if I send it over, my Dropbox is secured by a password, and also a second level is that they have to call my cell phone with a key that I have to put in order to access my files. That gives me at least some safety that if I'm looking at something, I'm probably not going to get hacked in there. Now, I'll tell you a story. My spouse works for a very large company, and this happened, and it's true. She works for a multinational company, and in the human resources area, the young lady working in HR, I received an email from the vice president, and it's saying, please send me the W-2s of all employees working at this one location. And she looked at it and said, that came from Mr. So-and-so. It must be important. I will do it right away. She then uploaded all of the W-2s for a work site, sent it to the vice president, and within 3 days, all of those employees had their income taxes filed with fictitious addresses and refunds going to a bad guy. Now, what that does is that creates all sorts of chaos with your personal taxes, with your personal income, but it is kind of mission critical that knowing that the bad guys just figured out how to hack into your email address and use it to send to people who would not think twice about sending the information over. Nobody thought, why would Mr. So-and-so need everybody's W-2s? Nobody thought to ask. Mission critical. When that happens in medical records, I'm sure most of you have encryptions, and you're sending your stuff encrypted when you send a medical record to somebody. So they have to make sure that they go through their process to make sure that they can prove who they are. If you're sending anything unencrypted with a patient name or personally identifiable PHI, please change what you're doing and enforce it with all of your employees. I'm going off on this tangent for a reason. I had a physician come to me and say, don't ever send me an encrypted file again. Tell the staff that if I get a medical record, just send it to me. I don't want to have to go through all that again. What do you say to somebody who signs your paycheck when they're trying to do something very, very, very wrong? You have to say no. And you have to say why. And you say, look, I said, I can show you all of the proof. I says, but I can't do that because, and I blamed myself. I says, I teach HIPAA, and I can't have a violation like this. And they looked at me and said, is it that bad? I said, yeah. So make sure that your emails are encrypted. Make sure that if there's something being requested that you're not sure about, or tell your staff to ask you or to go back to the source and say, did you request this? Okay? Or print it out and do it by hand and walk it over to whoever needs it. Okay. Flash or keychain drives. We know what these are. These are those little things that you buy for, $9.99 at Staples as you're leaving the store. If your employees are using them, have a policy in place that they have to tell you. One of the more interesting stories that I had was when I was at the university, we had a lot of fellows that would come through, and they would be issued flash drives. And those flash drives, the first time they plugged those into our system, the system would automatically encrypt them. But they were told that it was mandatory that they return the flash drives at the end of their fellowship. And each one I would sit down with at the end and gather up, any kind of books that they had or records that they had. And part of that was, I need the flash drive back. Now, this was about 5 years ago now. A young lady who finished her fellowship was heading off to Atlanta, was sitting there, and she says, "Oh, I don't have that flash drive anymore." And I looked at her and I said, "Please understand that that's going to cause me all sorts of problems. Where's the flash drive at?" And she turned all red. Sheepishly gets out her pocketbook out and takes a baggie out of her pocketbook. It was tied with a wire tie, and there were pieces of a flash drive in it. And she said, "You're not going to believe this, but my dog ate it." And I said, "These were the parts that were remaining on the floor, right?" And she goes, "Yes." So make sure that if anybody has one, that you get it back. And you can also ask your IT department to encrypt the flash drives as they're being plugged in, making sure that everybody understands that they shouldn't be using them. One of the biggest things in security that I recommend to people is to disable the USB ports on the computers. That is hugely inconvenient in many cases. I understand it. But if you can't plug a flash drive in, you're not going to have a problem with somebody taking information that they shouldn't. That's just the way it is. Writable CD drives, which you don't see a whole lot anymore, or writable DVD drives. You need, it's recommended. Disable them. You don't, do you really need them? That's something that you want to take a look around and look at each one of your computers. That's important also. If you watch somebody using a smartphone with their camera, if they're making a lot of photocopies that you don't know what they're photocopying, email out, email in, a bad guy is following your staff around, or a bad guy could walk in, and this is a true story. One facility I worked at, every laptop and every handheld device was encrypted, and everybody made sure that it was encrypted. So the bad guys came in one evening as part of the cleaning crew and walked off with 11 desktop computers. The only thing they left was the monitors and the keyboards. Mission critical, that everything gets encrypted. And again, what will the headlines be? All of a sudden, you don't want the CEO reading the newspaper saying that the local hospital or the healthcare facility was involved in selling medical records. Even if you didn't know about it, even if you didn't know how it happened or you weren't involved in it, it's still your fault. And if you are the compliance officer, it will truly be your fault. And that's something that you don't want. That's why if you walk around, I believe in managing by walking around. And you look for things. It's called looking for trouble. But when you find it, you have to do something about it. Like I always say, if you don't want to find something, don't look for it. But say you walk into, from a quality standpoint, this can happen. You walk into a room where a nurse smacks a patient in the head. Would you do something about it? Of course you would. You walk into a room and you notice that a doctor is going to give the wrong injection to the wrong patient. Would you do something about it? Of course you would. You walk into the OR and they don't do a timeout and they're going to operate on the wrong leg. Would you do something about it? Of course you would. You walk down the hallway and you see a stranger walking with medical records and you wonder what they are doing with them, and you say, "Oh, it must be somebody else's problem," and you don't do anything about it. This is critical. You need to stop and do something about it, and be pleasant about it. You can be nice about it. You stop them and you say, "Hey, can I direct you somewhere?" And then talk to them a little bit and find out what they're doing there. And if they're doing something nefarious, I'm sure you have people around that can help you with it. Okay, accidents. What can happen? The dog ate my flash drive. We talked about that. Car accidents. You have somebody driving around with a laptop or a box of audit materials in their car, and they have an auto accident. Is that a violation? The car gets towed away, and you don't know where your records are. Law enforcement. This is a true story. Law enforcement. Does HIPAA apply to law enforcement? It's past the statute of limitations, so I can tell you the story. Back in the early 80s, I was in the finance department, and a young detective walked into my office, and he showed me his badge, he showed me his ID. I believed as he was who he said he was. He says, I need to know if this person was in your emergency room on a given night. And I'm sitting there going, all right, so what's, even prior to HIPAA and all that, you guys sit there and say, all right, well, what's the right answer to this one? He was local, and I believed him. And he says, I need to find this guy, and I can't tell you why, but I need to find him right away. Well, he's in, that's an active, I presumed it was an active pursuit. And the only thing I said was, yes, he was here. And I looked it up, and I said, yes, he was here. He said, fine, thanks, and he left. However, today, would that be a violation? I think it would be. Up in New York City, we had a celebrity came into our hospital, and a gaggle of paparazzi, I guess you call them, and the media were outside the hospital. And they accosted our chief nurse out of the emergency room as she was leaving, and they said, how's he doing? And she said, you'll just have to ask him when he leaves. And she left and got in her car and went home. She was fired the next day for acknowledging that the person was there. It is a problem. Okay, so you need to have that in your policies and procedures. What will you do if law enforcement shows up? All right, theft is one thing. Wrong address. This happened to me not even 3 years ago. I had a record that had to be faxed to a facility, and it was a very, very medically sensitive file. I got the file together. I went through it and made sure everything was in there that needed to be in there, and I gave it to my staffer, who then faxed it to the fax number that I wrote on the fax sheet. I called the person that I faxed it to, and they said, nope, it never came through. Well, what's my responsibility? Well, where did it go? And I look, and I wrote down the wrong fax number. I transposed two numbers, and guess what? It was a real fax. In this day and age of Google, which was an interesting concept of it, was I was able to Google that fax number, find out what company that fax number went to, and then I called that company, and I said, did you just get a fax? And they said, yes, I don't understand. And I said, don't read it, don't look at it. I will send somebody over to get it. How many pages do you have? I have 20 pages. We wrote up an incident report, and it was, thank goodness it was okay. We could figure out where that fax went to. Goes to show you, though, how many faxes go out every day, and you're not really sure where the fax went to. Wrong addresses are more than just mailing addresses. Also, just one thought on that is that we'll talk about this too. Subpoenas. We all get subpoenas every day. If a subpoena is not signed by the court and usually embossed with their little embosser, they're not really valid subpoenas. They're just a way for a law office to gain more compliance from us so that we get the records out fairly quickly. Case in point in New Jersey, and it's a public case, a doctor's office got what they thought was a subpoena for all the medical records for a young lady. They sent all of her records over, including her psych records. And here the attorney that was requesting him was the divorce attorney representing the husband. The husband was able to secure custody of the children using those medical records. The ex-wife sued the doctor and was awarded $5 million. Needless to say that, and the doctor had to close his he actually sold his practice and went to work for a super group because he couldn't afford to stay in business. Okay, so how do you protect yourself? Managing by walking around and making sure that you document. If you document today that you noticed that Johnny Jones was doing a lot of faxing, you asked him, you inquired about what it was, and he said, we're catching up on some stuff that we owe to Horizon Blue Cross. And you look down and see all the records were, in fact, Horizon Blue Cross files. You thought nothing of it. But you walk around next month and you notice that he's still doing what you think is a Horizon job. It may not be. So double check and check again and look at it. So you're still working on that Horizon job. No, now we're doing X, Y, Z and check and see if it is happening. You need to have a process and procedure for preventing unnecessary activity, such as how many open doors do you have? I know in my practice we have 11 doors. And of those 11 doors, I keep 8 of them locked all day. And managing by walking around, just check and make sure that they're locked during the day. Because some people will leave the door open and you will have unfettered access to your facilities. Now, if you're in a hospital, it's a public facility, I understand. Make sure that your security department is up to speed. Don't want to degrade the need for security at hospitals, but many hospitals that I've been at, I could probably outrun, I'm old, but I could outrun the security guards. But make sure that they're checking IDs. This is a true story. When I was a consultant, I had a number of hospitals in New York City that I consulted at. So what I wanted to do was I didn't want to go through the vendor doors with them. So what would happen is that I would ask whoever my client was, generally it would be a C-level person, like a vice president. I say, look, I don't want to go through the vendor door. Can you get me an ID? And they would call security, and security would provide me with a photo ID for the hospital. So then I could just go through the main door, flash my ID, and go through. I ended up with a ring of 5 hospital IDs in New York City. What did that get me? It got me into every hospital in New York City because all I would do is if I didn't want to go through the vendor door and I needed to see somebody, I would look at the IDs, find a similar looking ID, and just breeze past the security and say, hey, good morning, how you doing? And keep on walking. They would never think twice about it. Now, when you do that in your facility, if you're at a hospital facility, think about how far you can get into the hospital without being detected. Grab some charts or grab some records or get some information that you shouldn't have and leave. It's huge. It is absolutely huge. Whisper campaigns, they work both ways. Make sure that your staff understands that you're not going to tolerate breaches. Make sure that they understand that the fines are tremendous, so that they understand that they will be terminated if they violate these things. They could be subject to criminal charges. Make sure that they understand it when they get oriented. This sounds like a downer for them, but at least they know that it's important. Most of us nowadays drug test our employees. Heck, this is a lot less onerous than getting drug tested. Also, on the other side is that you don't want a whisper campaign going around that you're an easy target. Okay, so if you catch somebody, you might want to make some noise about it. Make sure you understand what you're doing with that one, though. It's never a good thing to make too much noise, I guess. Handling of confidential information. Your EMR, huge. You don't want your EMR out there. Scheduling. A lot of times people say you can make a schedule on the patient portal, but the fact is that you want to make sure that your patient portal would never show people who else is on the schedule. I've seen that happen. Email, unsecured email, not a good idea. Facebook, LinkedIn, never a good idea. Phones, flash drives, and obviously credit cards. You need to protect all this stuff as if it was your own. An example of this, it gets busy. I know our office, we'll see 75 patients on a Thursday, and they were for all. We have 3 different services. It could be for any one of those services. What you want to look for is how fast these people are going through. You know, they're saying, Mrs. Jones, and we, you know, at the beginning of the year, we're renewing everybody's insurance cards, we're renewing everybody's IDs, taking their pictures. I don't know if you've ever had it, but sometimes you end up with a couple IDs and credit cards sitting on your desk, and you're not quite sure who they belong to. Make sure that the process is in place to not go through, that your staff knows not to go through them so fast that they forget who they are, who the patient is. Some protections. We did install cameras in our work area so that we could see who's going into restricted areas. I did have a case last week where I walked into one of our secure areas at the office, and I noticed that one of my key medical records doors was unlocked, and the door to the outside was open. Caused a little bit of panic, not panic, but my stomach went up into my throat going, oh man, what's going on? And I went back, and we had cameras that record, so I was able to, slide essentially the images back to when it was. And I realized it was our handyman doing a job that I had asked them to do last week that they finally got around to. So I knew who was there, and once they were done, they actually locked up, which was nice too. Restricting internet access. Do you want your employees to be able to go to Dropbox or to Google Docs? Talk to your IT people. You can always review history on computers, and you can ask your IT people to restrict it, that they can't take it with them, that they can't clear their own histories. Restricting tablet computers to break areas. Remember, your tablets have cameras on them. And heaven forbid you have celebrities in your office, because you can obviously see, they can take a video of a celebrity in your office, post it on YouTube, and then you have all sorts of problems. And educate for compliance. Make sure they understand that some people say, I don't know if it's a violation or not, okay? When you have your truck comes around for shredding your paper, and do they shred it on site? And if they don't shred it on site, and yet they give you a certificate of destruction, how do you know it was shredded? I always like to have the shredding done on site, and I can generally see it out my office window, so I don't toddle out there and actually watch them shred it. But if you don't know that they didn't do it, you don't know. And he goes, well, I have a certificate of destruction. If they just sold all that information, it just doesn't matter. One of the other things about shredding companies that I'd like to see too is that does the shredding company guarantee security through total destruction? The federal law requires a certain size shred. That shred can be reconstructed fairly easily, although you'd have to have a lot of patience to do it. But I know the ones that I use shred to pulp, and they track it to pulp, so they only use one pulp company that handles all of it. Not a bad idea. You're then taking on the flavor of the law and going beyond the letter of the law. ID check everyone. Contractors, you should include them in your education. Have your ID check when they come in your business associate agreements. I just had today, my electrician was in the office, my phone company was in the office, my data processing company was in the office, and my security company was in the office. If somebody comes in and they have a shirt on that says they're from your security company, never presume that they are from your security company. Think about that. That would be an awesome way to get everybody's information. Let them in and let them get access to all your cameras and stuff. That would be good. Family members. When family members come in, this is something that we have since my practice is 92% Medicare. What you want to do with that is make sure that you ID check the family members and that the patient agrees I always have family members coming in, and they're saying, I want to talk about the bill. You know, your billing company did this, your billing company did that. It happens to all of us. And you have to say, and who, you know, basically, who are you? And they say, I'm Mary Jones, I'm Mr. Smith's daughter, and I handle his bills. And I nicely say to them, does your dad agree that I should talk to you about this? Because if I'm just talking about the bill, that's one thing. But it's obvious that I'm going to have to be talking about procedures and diagnoses. So that's a key thing, is to make sure that the family members that you're talking to, the representatives that you're talking to, the caregivers that you're talking to, ID check them and make sure that the party, your patient, agrees with that. One thing that I do agree on is computer placement. If you leave a laptop out in the open near your front desk where it could easily walk away, presume that it will. And that is so important. Or if a patient comes in and says, hey, can I jump on your computer for a second? I want to get something, I want to check my email, or I need to check something, or I don't have my insurance card, but I have the numbers. Let me get on your computer for a second. I have a policy. Nobody gets on your computer that's, you know, an unknown person. Passwords. This is key. All right, you got passwords in your computer that represent you. I know with my passwords, I've done this, and I cringe every time I do it. I have new employees come in. The employees start, and on the first day, IT never has their IDs and passwords set up yet. Okay? So as we're training them, I would say, like if I bring on a new manager, which I just did, here, use my password and name and log in so I can show you how this EMR system works. You need to document that and keep track of it on your own so that you change your password as soon as you can, probably by the end of the day, because you got a new employee there. They're an untested, unproven entity until you're sure, but you need to train them. So these are that's the smallest thing that could get you in a lot of trouble. I had an employee that had the password and ID of another supervisor, and she didn't make probation. So, you know, there's a checklist. You have a checklist for all employees who don't clear probation. You know, you clear out their email, you clear out their passwords, you clear out their access. But, you know, who gave them their password? Make sure that they change. Whoever supervises them changes their password right away. And I would say probably, you know, don't even presume. Just have them do it. I'm sure you all know that you keep your employee records, health records, separately. Don't keep them with your HR records. And you have to have basically minimally necessary information on that. That's important. Knowing in your office what has medical data on it, copiers, medical equipment, X-ray. If you have old X-ray films, that's true. You know, and digital cameras. I have a couple sitting in drawers. CDs, USBs, phones, tablets, the cloud. Your video security, like, you know, I have a DVR system or a recording system. Old dictation equipment has it on it. Even old IBM Selectrics. The old IBM Selectrics with the ribbon tape, you could read what was on it. Again, make sure it's not there. We talked about the profit of fraud and theft, Medicare, Medicaid, medical records, credit card numbers, all of the above. We check IDs now, but how many times do people with a medical card, like a Blue Cross card, show up and it's really not them? They borrowed their aunt's health care card just to go to the hospital. Could be. How do you know?